As we honor veterans today, it's important to remember our nation's heroes sacrifice a lot to serve our country and keep us safe. In fact, studies show they can face an alarming risk of developing lung cancer due to their service-related exposures. Recently, the VA expanded cancer screenings for veterans. Dr. Arya Kumar is a radiation oncologist, and Tim Kukich is a Marine veteran and lung cancer survivor, and they join us today. Thanks so much for being with us.
Thank you.
Thank you.
So let's first talk a little bit about this exposure. Why are our veterans at increased risk for developing lung cancer?
I think there's two primary reasons. The first being those exposures you mentioned. Our veterans are exposed to more cancer-causing agents and other things during their service compared to the general population. Compound that with the added risk of them being smokers. But lung cancer itself is an aggressive process, and not catching it early means that we have fewer treatment options and less effective treatment options. So lung cancer screening is a great way to try and identify lung cancer earlier before it's symptomatic so that we can have better outcomes and better survival rates and save our veterans' lives.
Yeah, it's super important. Tom, talk a little bit about your story, your service, and then how you found out about your cancer diagnosis.
Well, I was found out that I had cancer when I went in for another situation. I was having a heart problem. So I went into the VA and they did a CT scan on me and saw a small spot on my lung and monitored that for a couple of months and then went in and did a biopsy and found out it was cancerous. And then I was treated for that. But in my case, my cancer was discovered early in stage 1 cancer. So in stage 1, it's much more treatable and much more curable. And of course, that sort of saved my life.
And that prevention there is key. Doctor, you mentioned screenings and catching this early. The VA now offers screenings that are free to some veterans. Talk a little bit about those qualifications and what those screenings are like.
Yeah, absolutely. So the screening process is really geared towards those veterans and those patients who are the highest risk of developing lung cancer. So those are patients aged over 50 years old, or patients who are current smokers or who have smoked in the last 15 years. So if you fall within that group, please contact your VA doctor and certainly learn more about how your local VA is handling the lung cancer screening process.
Yeah, what is that process then like? Is it, because I know that many people will be like, well, if there's a lot of red tape or it's challenging, I'm just not going to bother with it. But, what is that process like and why is it worth it?
It's become very seamless. The VA screening program has really expanded over the last few years. A veteran simply makes the call to schedule a doctor's appointment. They determine eligibility, fill out a questionnaire, and then get the CT scan. And the CT scan takes about a minute or two. There's no needles, there's no contrast involved, so it's completely non-invasive. And that's pretty much it. Then we have the first screening study.
And Tom, talk a little bit about, encourage other veterans out there who may be putting their health on the back burner or saying, I'm not just not thinking about it, honestly. How would you encourage them to stay on top of it and get those screenings?
Well, certainly it's something that every veteran wants to do sometime eventually, because diagnosis on these early stages of cancer stage 1, much more treatable. And of course, it could kill you. And that's what you have to be aware of. And there is no pain involved with this until it's too late. So I encourage every veteran to go out there and get scanned, because it's free and it's painless and it's quick.
And as you said, if you detect that early, it's a far better experience, getting that treated and getting that taken care of. For people who want more information, they're like, you know what, that's me. I really need to get screened. Where can they go? Where can they get more information?
Well, they can contact the VA or they can go to lcfamerica.org for further information.
Good information, especially today, to get out to our veterans today. And Tom, thank you so much for your service. We appreciate that sacrifice you made for us.
Thank you.
Yes, and gentlemen, both of you, thank you so much for joining us today.